Hi, I am Jessica Marie with JMarie Skin Studio, and today I'm going to be demonstrating a Botox injection. So why would we use Botox? Well, Botox works on the muscle that creates the wrinkle. It does not work on, eliminating the wrinkle. We gotta target the muscle that creates it. The way to know whether or not your Botox is legit, it's a real deal product, is go ahead and take a look at the bottle. And I teach all of my clients to do this because you'll see that Botox, there's a little hologram on there that says allergen. That's how we know it's the real deal, okay? So don't be afraid to ask to see the bottle. So let's go into how we would assess for Botox, okay? So in this area here, this is our glabellar and our procerus muscle. You can see how all of these muscles are creating these deep wrinkles. And I'm going to inject right into this guy because we want to go right into the belly of that muscle. I'm also going to inject right in here. You sometimes will hear about people saying, well, I had Botox before and I had a droopy brow. Here's what happened. Outside of this pupillary line, so here's the mid-pupillary line, this muscle here becomes a depressing muscle, meaning that this is going to drop if there's any Botox in this area. Everything from here to here is an elevating muscle. So Botox is actually going to go in and it's going to lift. So when people tell me that they had a droopy brow, most often it's because they had Botox into this space here, which actually caused an itosis, okay? So you want to make sure that your injector is a little bit more conservative. I can bring him back and I can inject more if I need it, but I can't take it out. So I really like a conservative approach. We also have to be mindful that because this is an elevating muscle, this is going to raise when I inject Botox into it. We want to be mindful that, especially when we're doing a men, that we don't necessarily arch his brow. So I'm going to keep my injections very centralized on my men unless they're going for that look, okay? I can see that he still has quite a bit of muscle movement in here. So I'm just going to weaken that up and soften that a little bit as well, okay? We also need to be mindful of how big this corrugator muscle is. Sometimes it goes this way. Sometimes it goes all the way up into here. So would it be enough for me to just do one injection? I have to hit the entire muscle and make sure that I'm going for the belly, okay? Okay, so now let's talk about the forehead, which is also known as the frontalis muscles, okay? So I'm gonna have you raise your eyebrows for me. I like to start with the center of the frontalis because anything I do on the right, I'm gonna do on the left unless I am trying to balance out any asymmetries here. So go ahead and raise your brows for me. Super. Now, there's not a lot of muscles in this area, but for this particular gentleman, you can see the strength of the muscle here. So in this case, I am gonna hit that muscle group, okay? I like to do little injections and little aliquots of Botox throughout this space, so that way there's still some movement. To me, if your face is completely frozen and people can look at you and tell you had Botox, we're not doing it right. You should still be able to smile and raise your eyebrows and have expression, and that's kind of my jam here, and that's what I'm known for in the industry. Okay, so go ahead and raise. We're gonna go all the way up to this hairline here. Okay, sometimes if you guys have ever had Botox injections and you get this surprise look here, your brows arch really high, and every time you raise your brows you get this small arch here. What that means is that the injector did not hit that muscle group, or they did not do enough, which is not necessarily wrong, especially if this is our first time injecting you. We don't know how your muscles work. So rather than risking drooping the brow, I prefer to stay conservative until I learn a little bit more about you and your muscles, okay? So now here we go. We got I think that's a pretty good pattern. When I put Botox in, it's also going to disperse. So I don't need to inject this entire muscle. I just need to inject enough to hit the belly of that muscle group there, okay? So now I'm going to have you smile for me, and we're gonna soften up his crow's feet as well. So first off, you wanna go outside of the lateral canthus, and I want to fill for the orbital rim, and I want you to smile for me. And we're just gonna inject right here. Smile again. Okay, and then look straight at me. And I want you to raise your brows for me, and I want you to smile for me. Now, this gentleman does not need to have micro Botox, but sometimes if women have, relax, some creping underneath the eye, we can go in there and we can do some micro dosing of Botox. It's super important not to overdo that area and keep it really conservative, because we don't want them to have that kind of mad cow look, right? And because this is a depressing muscle. Typically, people will charge for Botox by unit, and it goes anywhere from $9 a unit all the way up to $16 a unit. There's other places that charge by area. So ask those questions when you go in to see your provider. So now we are ready to inject, and essentially the Botox works by breaking down the acetylcholine production in the muscle, all of those little fibers that gives it strength. So if there is not strength in the muscle, it therefore can't make the movement and therefore can't make the wrinkle. So that's why we do Botox. I like to start around the eyes because I like to have a sharper needle for the eyes. This area is super vascular, so it's pretty easy to bruise someone here. And then I'm going to do just a small poke here and a little injection. You're gonna see these little bleps underneath the skin, and those will last for about 15 minutes, and then they will go away. It's super important that after you've received your Botox injection that you do not rub or massage this area. If you have clarisonic devices at home or any, brushes that you're using, you want to avoid those for about a week to 10 days, because we want the Botox to stay in the muscle group that we put it in. Now, when that Botox starts being manipulated, like with facial massage or with acupuncture or with clarisonic devices, we can risk that Botox going into other muscle groups and maybe dropping a brow or getting into other muscle groups that we didn't necessarily want it in, okay? Squeeze those brows together so that way I can pinch that muscle and relax. Small pinch, poke, and sting here. So for about 7 to 10 days, no facials, no facial massage, no acupuncture, because we want the Botox to stay in the muscle group that we put it in. You are welcome to use things like ice if you are worried about bruising. You can also take arnica for a few days prior to being injected, and arnica is just a homeopathic, and essentially it helps with bruising and with the swelling in the tissues. You are going to get a little bit of blood, especially in this complex, because it's a bit of a deeper injection. I want you to squeeze those brows together again. Perfect, and relax. This area here is very vascular, but we don't have to go as deep here. And just before I inject, I double check my markings here. I want to make sure that I am in the muscle group that I need to be in. Again, I want a really sharp needle for around the eye, so I'm going to have you smile for me and relax. And that's why oftentimes during treatment, I bounce around. Okay, I want you to raise your brows for me. Good, and relax. And again, this is just to double check that my markings are correct. Some injections will use 1 unit, some injections will use 2, some will use 4, and it's all dependent on the strength of that muscle. So I want you to go ahead and raise your brows for me again and relax for me. Perfect. How are you doing so far? Good. Go ahead and raise your brows for me and relax. And now that I have him laid down and I'm looking at this muscle a little bit closer, instead of doing 2, I'm going to pull it back and I'm going to inject right in between those 2. Because again, this is the muscle that can droop the brow, so I still want to stay very conservative here. Go ahead and raise again and relax. So once we are through with the injection, I am going to use a little bit of arnica because this just helps the tissue heal more quickly. It helps reduce the swelling and the inflammation, and the pressure that I'm doing here is exactly what you should be doing when you are at home, cleansing your face, putting on your makeup. It's just light, gentle pressure. Okay, these little bumps here will go down in the next 15 minutes or so, and Ray is going to make sure that he does not sleep on his face, that he doesn't apply a lot of pressure here, that he's not getting a massage or a facial, anything that could compromise that Botox getting into other muscle groups. He's going to notice results in about 4 to 5 days, and what he'll notice is just that he has less and less movement. I will follow up with him in a month, and if we need to tweak anything, then we can certainly do so at that time. Also important when he comes in for his injections to not be on any blood thinners like fish oil, vitamin D, ginkgo, aspirin, ibuprofen. All of those will thin the blood, which could increase bruising. Thank you so much for joining us today. And if you are interested in learning more about our studio, please visit our website at www.JMarieSkinStudio.com. Also follow us on Instagram and Facebook at JMarie Skin Studio for some more awesome beauty tips.